Hello everyone. I hope you all are doing good. Uh, Today we will be discussing health policy and its analysis. That we will be discussing managing and we will be categorizing different policies by looking into different policy levels and analysis of different policy by different governmental sectors, controlled or formulated or given by uh, personnels, policymakers, and different governmental officials who are responsible to formulate a policy. In this regard, as we discussed in our class, I am today is covering health policy. I'm trying to elaborate health policy, its issues, its formulation, and its analysis. That how we are going to analyze health policy. You can take this as a model. You can take this as a uh, case study. That how we are going to analyze, how we can make an analysis of any policy, any given policy. Like uh, in this setting, in this session, we will be elaborating, we will be analyzing health policy. So as you all know that health is the primary issue, health is the primary need of human beings. Health is the core of every government in the government that uh, not any prime minister, president, or any governmental official can ignore the health in his or her country, because health is directly related to the people of that country or nation state. Without health measures, without appropriate health facilities, there are so much there is a huge criticism on a government which neglect the health issues. For instance, when in previous uh, tenure of American President Barack Obama, when he initiated health policy plan and he started to give people benefits regarding the health issues, that government was appreciated, that bill was appreciated, because health is the primary source, health is the primary matter in a country settings. Health can make or disrupt the public mood, the trends in the government, inside the government and outside the government. So we cannot, you can say, ignore health. We cannot ignore the well-being of people. It is very important that we stick to the policy agendas. The government should stick to its policy agendas and make health its priority. So in this regard, today I am presenting you this session to give you a proper look in health policy issues and analysis. So in this regard, first of all, we need to define what is health policy means. How can we describe, how can we determine, how can we define the matrix under which we categorize health policy? So the first definition which I gathered is a set of decisions or commitments to pursue course of action aimed at achieving defined goals for improving health, which means that there are some set of decisions that we are bound, we are abide by those decisions by the government or the commitments by the government. but commitments or decisions for what? Because to pursue the course of action. And what will be the goal of that course of action? The goal will be improving health of the people of a state or a nation state. Secondly, policies usually state or infer the values that underpin the policy position. This point is about policy positioning, the policy, the prioritization of policy. That how a government is prioritizing its policy, how the values of that government underpin the policy position, where the health policy stands, where the health comes in the policy agendas of a government. Third, they may also specify the source of funding that can be applied to action. So I'm going to take a pause here, and I'm going to elaborate the importance of the specification of the source of funding. Why it is important that a government is looking for the source of funding? Because when we discuss planning, when I give you the model of planning, when I described planning in your class, the first important point, the major important point was, for the planning we need resources, we need wealth, we need capital to invest in our plans for our policies. So the government or an agency or a particular person even is making a policy for anything else, let's say for health, let's say for accountability. For that, for the fulfillment of that policy, we require funding. The source of funding should be applicable. The source of funding should be specified. And when we connect the other part, the planning and management arrangements to be adopted for implementation of the policy. Now, the second portion is this. I'm going to mark you that you may note that what we are talking about here. The planning and management arrangements to be adopted for implementation. Now the implementation is important. Now here the key word is implementation, which means that we covered the stage. We have undertaken the step of fundraising. We acquired funds. The funds are dispensed on our proposal and on our disposal, sorry, and now our policy or the planning initiates in the implementation phase, and the relevant institution to be involved. Now when we have funds, we will start implementation of that policy, and when we implement a policy, we need institutions, relevant institutions. For instance, today we are discussing health policy, so it means that the relevant institution is the health personnels, the health care providers, hospitals, Ministry of Health, health ministers, bureaucrats. So this means that the policy undergoes from phase to phase, from one point to another point. First of all, we as we discussed, funding is important, then management arrangement and implementation, and in the last, relevant institution. Moving forward, Aim of health policies. Every policy in a country, every set of policies which we follow have aims, has different aims when we talk about policies, when we make a category of different policies. So I dissected those aims. I tried to define for you and try to make it simpler for you, for your understanding. So the prime aim, the very foremost aim, the most important aim, the central aim is maintenance and improvement of the health status of populations. Not population, but populations, without any discrimination, without gender parity, without any class, creed, or any difference, which include populations, not a singular population, but different populations. So the prime aim of health policy is to maintain and improve the health status in a country. It is very important for the policy makers, for the policy givers, that the status of health of population will be maintained on a optimum level. The balance between health and the other policies in a country is very important. The second point is, the second aim is that the risk factor which influence health differ between countries. From country A, you have country A, we have different set of health factors, risk factors. As we move from one point on a globe to another, from one country to another, the risk factor varies regarding health issues. In some countries, there are different diseases. For instance, in Pakistan, we are fighting with polio. We are trying to eradicate polio. But in the Western countries, on the contrary, the polio has been eradicated a decade ago. So it means that we have different risk factor for different countries. We have different, different set of problems which every country has to face when it comes to the health policies. So the aim is to address those risk factors. The aim is to address that difference from one country to another country. We cannot make a generalized policy and we cannot implement it on every country in the world. Thus, the policy for health will be influenced by different factors in each country and region. Because of the risk factors, we will indicate different factors of that difference. That how difference emerged, that how difference can be addressed. So in this regard, this will be the aim of health policies, to measure the different factors, to indicate different factors which is different from each other, which is different from one point in one country with the other point in the other country. Addressing the issue maintenance and improvement of health status of population is the aim of health policies. Moving forward, so there are essential concepts we will be discussing essential concepts regarding health policy. Very important concepts regarding health policies. We should know these concepts while understanding, while developing a policy, as we discussed in every class, that we should know the basic concepts, the basic conceptualizations regarding any issue. So here we have four different concepts. Health status. I will get back to their explanation when once I done with this slide. Second number is health services, but these are self-explanatory terms, but we will discuss them in later slides. Third is organization and financing, health commissioning, which means we need to develop a wide administration, a very vigilant, wild administration for financing. Number fourth is role of public health, assurance of appropriateness, criteria, access and utilization, CAU. So criteria, we need to define different criterias. We need to access with different on different resources, and we know the utilization of those resources. So when we know these concepts, we can formulate or we can analyze health policy. Moving towards the explanation. So, what do we mean about when we say health status? Which means that in a very raw form, in a very easy and simpler way, uh, if someone say the health status is good, health status is bad, we uh, we we have a very important and we have a very clear image in our mind that what we are talking about. We are talking about what type of health services we have, what type of diseases we have, what type of uh, counter actions to cope with those health issues. So increase in non-communicable diseases in the developing world together with the abatement of the mortality from infectious diseases. It means that the health status is changing. Health status is in a constant array that from one point the increase in non-communicable diseases. The very recent crisis from which the world is going through is COVID-19. The issues which we are addressing nowadays, the health status is or has been challenged because the mortality from infectious diseases varies from one point to another. Secondly, in developed world, the problems are mainly concerned with the elderly rather than children because of the immune system. As we all understood by now, as this novel corona COVID-19 has taught us that the immunity is important, that without strong immune system, it is very likely to catch that disease, catch the pandemic. So the in developed world, what is the problem for developed world? They are good, they have good living standards, they have good policies, they have good health care. But what are the concerns? If we take the example of COVID-19, that what are their issues? Why they are facing so many issues? Because the problem in the developed world is elderly, the people with the aged people, rather than the children, because in children have a very strong immune system in them. So we can apply this concept, we can apply this in this current scenario, in this current status of health. And this has important implications for health policies. Here I am trying to establish a fact that from one point in a world, in a country, the issue of diseases, the issue of the categorization of diseases are different from the other part of the world. And this difference is the health status. And this health status has important implication. So let me draw an arrow for you so that you may understand this, that health status has important implication. Health status means that what country is vulnerable to which disease. Moving forward, the health service problems faced, the people who are making policies, the people who are establishing different policies and trying to make policies in regard to the betterment of people, what are the problems they faced? Inequality between different geographic areas and social groups, that there are different geographic areas and social groups which cannot be treated as the treatment of the other part of the world because of the geographical constraints, because of the social and cultural constraints. Different people have different mindset to the treatment. Different people have different customs, different taboos for the health. Let me give you an example from this, that in recent years, the increase in the mental health issues or increase in the depression or anxiety, people started to come forward. They started to talk about it. But before that, but before this issue, before this crisis, people, this psychological issues are considered as a taboo. They were shy. They thought that we should not talk about it. We will be categorized as mad people. So variation in the utilization of services for similar conditions. So it is very difficult to operate in various situations, because with the situation, with the passage, with the outcomes, the areas, the geography, the social groups, the social structure, the ideology is different. So the difficulties in the appointment of limited resources. When we talk on a massive scale, when we talk about uh, different scenarios in different under different crises, we talk about we talk a huge scale. We talk for the entire globe or entire world. When it comes to that huge or massive massive uh, need of health care or health services, the resources become scarce. The resources become limited. The lifestyle, behavior, and political economic situation and the health services have an essential role in improving quality of life. The quality will be improved if the socio-economic status in a society will be you can say increase or improved. So that gives the valuable improvements in other aspects of health status. So organization and financing. This is one another important and interesting, you can say, slide. The state is involved in all health system in varying degrees. By now, you can understand that by discussing different matters, by discussing different scenarios, we understood that state is the main entity here. The state hold the cards here. The state is involved in all health systems in varying degrees as legal regulator of the arrangement for patients to receive medical care and doctors to receive remuneration. Remuneration means their pay, their capital. So legal regulator of arrangement for patients, that patients should be regularized monetarily as a contributor. The first point was as a legal regulator in which the government body is involved, in which the government relations with doctors or the healthcare providers is established, is made. Third point is as a contributor to healthcare financing, like an NGO, like an institution, or like social insurance, that who are responsible for giving people necessary health services. As a contributor to healthcare finances, taxes or compulsory social insurances are assured by the contributors to healthcare financing, or as a guardian to ensure that correct balance of resources is used to achieve optimum population healthcare. Healthcare may be conceived in an economic framework as an exchange of goods, that if we are lacking in different medical supplies or health care supplies, we can exchange it. We can take part in different trade situations. We can create an atmosphere in which we will discuss economic framework, and we will talk about these issues in that framework, in that economic framework. So patients seeking medical care are making demands while doctors are supplying services. In this scenario, in this issue, when pandemic hits, the entire globe, we are seeking medical care or making demands by asking for doctors, by asking for the different medical specialists to come and tackle or uh, address the situation by supplying their services. And for that, we need finances, we need organizational support, we need organizational institutions and organizational administrations. So I think we covered that organizational issue and financing of that issue. We discussed that a state is the originator of that power, and we discussed different scenarios in which we discussed legal regulator as a contributor to healthcare finances and as a guardian to ensure that the correct balance of resources. Then health commissioning administration. That what we understood when we talked health commissioning or administration. Health commissioning needs to take into account the following factors. Number one, improvement in health. Number two, risk reduction. Number three, services and protection. And number four, data needs for monitoring and achievement of the task identified. So these 4 points, these four interesting thumbnails are health commissioning, administration, that we need to commission these 4 steps. We need to make sure that every person in the community or every person in the locality have access to these 4 issues, for these 4 facilities. In current situation, let's suppose we have an issue, we have an patient, or we are dealing with a survivor, or we are dealing with a person who needs medical attention. So what will we do? We will improvement the in health status by giving those populations, by providing those population with medical help. If they are infected, if they need medical attention, they will be tended to. Number third is how can we administer them? We can administer the risk reduction, that when we started, we will establish a comparative analysis from when we started, and with the passage of time, how we reduced the risk, how we made the risk reduced, what step we have taken to address the issue and then reduce the risk amount or the risk uh, surfaced for the people. Then services and protection. This is very important for healthcare providers or the health policy makers or the issues or the people who are dealing with the crisis, is that we need to define different services to protect different classes, different vulnerable classes in world, in the society. We tend to ignore children, we tend to ignore the women status, we tend to ignore the disabled, and we tend to ignore these minorities like the gender unspecified. These are the common practices when a crisis emerged. In COVID-19 situation, we also saw this as well. But health commissioning, it is the responsibility for the health commissioning that services should be provided for everyone, for children, for women, for elderly, for disabled, and for gender unspecified. It is the responsibility of a healthcare provider, it is the responsibility of the person, the focal person monitoring or operating in certain area to ensure this. If a person, if a children, if a woman is abused or if a child is abused, that services should protect those people during the crisis. This is the responsibility of health commissioning institute. We should address those uh, victims of the situation. Number fourth is data needs for monitoring the achievement of the tasks identified. It is important and it is necessary for the health commissioning that data will be monitored. Data is monitored with the passage of time, with the passage with to know the effects of their campaign, the effects of their uh, efforts. This is the reason this is how we take into account our own progress. For instance, uh, like polio, when we started, we have many cases of polio in Pakistan. But with the passage of time, although we are not polio free, but the reduction in cases and the reduction in risk is increasing. And we monitored that data from point to point, from making different gateways and checkpoints by United Nations and by United Health Organization, World Health Organization, and UNICEF. They collaborated with each other and they monitored. They made different gateways. From there, they checked the increase or decrease in the polio cases. Same is the scenario when we discuss this COVID situation. How we are dealing with it, how we are giving services to the person, to the people, to the women, to the children who are subject to abuse with the situation. There, they can be abused, they can be forced, coerced. So when they came to healthcare personnel that should listen to those people, that should monitor those persons, and with regard, this comes with the job description of a person to render his or her services for them as well. So, role of public health. We discussed different scenarios, we gave different examples, we defined health policies. So now, what are the chief responsibilities of public health? Why public health is so important? Why it is so important that we discuss all the time when we discuss health policy? We discussed public health because health is for public. You need to raise a flag in your mind, you need to take a mental note that the role of public health is important because we are dealing with the people, with the society. So the chief responsibilities are the surveillance of the health of the population, that a government or an agency or a healthcare provider or a mission have conduct or do a surveillance for the health of the population, that to know the trends, to make certain policy for public good. Secondly, the identification of its health needs. It means that we understand and identify the health needs of society. Third, the fostering of policies which promote health. Public health is important. Public health is for the benefit of people because due to public health, we enforce or we foster, we make those policies more communable, more definable, more strengthened, which promote public health. Public health increases the safety of people, safety of community, and for that we need the community, the policy need to be devised in which a government decides to make different or update different uh, hospitals, like the initiative of making a basic health unit. It is for the it is to promote public health in particular and health in general. The other responsibility is the evaluation of health services. We started with surveillance, that we monitored, that we started to know the health problems, then we discussed, then we addressed. Now what we do, like every policy, like every different policy, as we discussed in our class, that what is the phase? We discuss, we implement, we raise funds, we give the policy matter to the local machinery, from ministries to bureaucrats, and from bureaucrats to the public. Like every policy, health policy also include the evaluation of health services, which we conducted, which we previously uh, collected in the form of data, that what type of health services we have and what type of health services we lack. So the study of the nature and extent of disease and disability in the population. This is how we can, by the way, this is how we can evaluate. This is connected with this. The evaluation is done to know the extent of disease and disability in the population and how it varies with age, sex, economic and social circumstances, occupation and environment. That how this is affecting the occupation, environment, circumstances, economic and social classes and variants in a society, how that disease is behaving, how a certain disease is behaving in a society. This is how we can evaluate. Then the role of public health. Previously we discussed its responsibilities. Now we have the role in front. Thus the problem for which public health action is required include, why we want a public health action has to be taken by the government. Outbreaks of disease, problems rising from social and environmental issues, behavioral concerns such as smoking, health services issues, assessment of healthcare needs and outcomes, and the effectiveness and efficiency of particular services. This is the role of public health to stop these issues, to react and to act on the outbreaks of disease. Very fine example, very practical example is that when we discussed the initiatives of the government taken in response of COVID-19, we can discuss the environmental and issue behavioral concerns in this regard. Different psychological issues emerged. People tried to live inside. There are different issues with this problem, this pandemic. So when the government reacted, when the government devised a policy to address this issue, to address the outbreaks, to minimize the outbreak in different countries, they actually took action for the public health, for the betterment of public health. So when we talk about the outbreak of diseases, we have the current example, the current crisis in our hand to study this health policy, to study and to apply this health policy. Assessment of healthcare needs and outcomes and the effectiveness and efficiency for particular services, which means that for a disease, for an outbreak, what we need to do, what we, uh, how we are going to defend, how we are going to protect ourselves from different situations, from different time to time crises. And particularly in this regard, how we take care of our health and how we control the outcomes. Controlling of outcomes are important. Controlling of outcomes is very important because without the effort, without uh, trying to change or modulate the outcomes, how we are exposed to different threats of from the health situation, from this situation in which we find ourselves, in which we try to address the situation. So this is the question of public health. This is how we describe and decipher the effectiveness and efficiency of particular services. That how those services are given by the service providers or by the health givers. So public health as a discipline should not be become involved in direct management of clinical service in the community or within the institution. They lack the expertise of these essential tasks because they are to give people a material form of service by which the community will gain its, you can say, health, protect its health, and protect the health of its elderly and children. So, moving forward, so what are the international trends in healthcare? Every citizen in a country has the same rights to healthcare. These are the international standards. These are the international values of healthcare, that every citizen in a country has the same rights to healthcare. There has not been much of a decline in public financing of healthcare quantitatively, whatever by compulsory insurance, contributing, or taxation. The taxation is the source. The taxation is the main key by which the government provide health to its citizens, give the indiscriminate health status and health uh, to its citizens. The government initiates different insurance policies, different health care policies for the people, for the old age benefits, for the people who don't, who cannot work, who are elderly, who are disabled. So they were given healthcare facilities. There is some trend towards consumers making a contribution in the forms of co-payments, for example, participation charges. That if we want to, if a country or if a community want to provide elderly or want to give the finances to an elderly home or a facility, they will contribute, they will give, they will co-payment with each other, and they will the institution will, the facility will move on. The expenses of that facility will be divided like a part prescription charges. This is how a government is, and a state or a agency or a institution is making standards as international in its behavior and in its way. Some countries are encouraging people to take out private insurances or even to contract out of the public system, in which the government is uh, to give insurance and ask its citizens to participate in the different measures by the private insurance givers, that after certain age, after passing certain age, a person can claim, a person can have a fund. So this is international trends. This is how international health trends are moving. How they are uh, giving health to the people in the community. The trends are these setting points for the countries to follow. So the healthcare is taken very seriously, serious point in international settings as well. So from that point, from the international trends, our country mimic that international trend and apply that in its own society by keeping the requirements of its society in his or her mind. It cannot be tolerated, it cannot be ignored. The health system, the health care in any society, it cannot be uh, overlooked. So every country do its maximum, utilize its maximum funds in private as well as in public sector. The role of public health in the determination of priorities, which means that how what tools are to be devised to address the problem and to devise appropriate mechanism for their solution. What tools, what issues, what you can say, what factors, what variables which will come in our hand to address certain problems regarding health. In all the systems, however, the ability for public health to influence health policy is limited. Different systems makes a government, different systems in a country makes a huge overall system and entity, and for that entity the public health is very important, but at the same time that government, that entity have the limited health policies because of the limitations of the resources. So the ability for public health to influence health policy is limited. Decisions on priorities have become more explicit and democratic. So in a setting, in a country's or in a nation state setting, the priorities can be set the by following the examples and footprints of different other countries, by following the examples of modern world and the democratic world and the first world citizens, which we will say that which have the basic health facilities, which has the importance, which has access to the basic health facilities. But the question here that how they achieved this status, how they made it possible for their public to uh, to have an access on the resources. That was because of the priority given by the government. That was because the priority was set by the government, that it is the foremost responsibility of a government to prioritize the health issue and to fund the health sectors. For this reason, most countries have begun to debate how and what should be done to prioritize the health situation, to give different medical facilities to different ignored and marginalized classes. So the debate is going on about how and what should be done to give them the appropriate health and the appropriate help. Most have developed mechanisms for beginning to address the problem of inequalities and deprivations, because people who are not given the right to access the basic health system, the basic health mechanism, they are prone to different diseases, and they are prone to different physical and psychological threats. But with the passage of time, with the awareness, with the passage of awareness and different international standards, and being the globalized in word being globalized in nature, most countries have developed different mechanisms which were absent earlier in our previous societies to address the problem of inequalities that previously the government and the different other agencies discriminate on the basis of race, color, creed, religion, and different other aspects, in which we tend to discriminate among the humanity of this world. With one notable exception, the United States. But I would suggest that you should uh, dig deep into this point, because uh, this can be this this was supposed to be your assignment to uh, to tell me to write a paper about this, but due to some issues we don't have time to do this. So moving forward, most are facing the problem to increasing cost of medical care by rational deliberations. The priorities are being assigned. The priorities at one point are very important, but at the same time, at the same point, uh, it is difficult to ignore the increasing costs of medical care, the cost of medicines, the cost of medical structures, the cost of different medical equipments are increasing with the passage of time, and it is making it and it's getting difficult with every passing day for the government to cope with the changing situation with this regarding the prioritizing the medical health. So increased assessment in public health research in order to be able to introduce appropriate and effective preventive strategies. So uh, what should we do? What can be done? What uh, ought to be done by the government? This can be the basic question. This can be the basic. This can be the key question here. That if the cost of medical health, if the cost of medical care is increasing day by day, so what should we do? What can we do to prioritize or to make medical services available for everyone? So addressing this question, uh, the most important point is that the government of any nation state, the government of any country should invest in preventive strategies. Again, I will engage your attention here with the recent crisis in which we are struggling, in which we are trying to cope, that that the preventive strategies are being made, that we should prevent it rather to cure it, because we are trying to find the effective cure of that present crisis. But what we can do, we can make different preventive strategies. We can make ourselves safe, and we can make different other people, the community, safe by utilizing preventive strategies, by doing by the government giving the government started the quarantine program, that we should quarantine ourselves, we should prevent ourselves from giving uh, the infection to other people. So in this regard, we will prevent the issue, we can prevent it if needs be. So it is very important rather to check on the preventive side of any disease, any health issue, to gain the control over it. So we can make policies, we can make strategies for prevention. This is how we can prioritize our health. This is how we can give uh, health indiscriminate to the public of any country, to the public of any society. Moving forward, health policy in developing countries. So we have three different aspects, but the central issue is the making the best use of limited resources in environments in which there is a wide gap between needs and resources. It means that we have a central issue. It means that we need to address the central issue. After, after addressing that, we will address diversity, complexity, and change. So the central issue is to operate under minimum resources, under limited resources. The central issue is to make best use of those resources for the expectations and performance. So there are three main issues which we discuss, which we will address while analyzing the health policy in developing countries, the countries which are uh, still yet to be developed, yet to gain the status of developed countries. So we have three issues. We have three main issues by which we can analyze, by which we can draw analysis of a health policy for any country, and we can devise a possible solution. We can devise a possible outcome from these three issues. So what diversity means? Diversity means that what is different. Ecological and geographical factors account for some of the variation in the pattern of distribution of health and disease, but economic, social, and cultural determinants also contribute to the diversity. The society is made up of diverse populations. The society is made up of different minds, different school of thoughts. The geography is created different determinants for different parts of the world, and like those differences, like those distribution, those variations, the disease and the health situation is different. So there is diversity in population, and there is diversity in health and disease also, which enables economic, social, and cultural determinants more important for the health cares, for the health givers. The next is complexity. The explosion of new knowledge and innovative health technologies made it is very complex for healthcare providers. It is necessary to mobilize intersectorial action because of the important influence of non-medical factors on health such as agriculture, education, waterworks and sanitation, labor and industry. Change is transition. Change is what we are uh, experiencing. Change is what we are dealing with. From traditional health problems to this new health problems, from childhood to the adolescence and from adolescence to the adulthood, such as childhood diseases and communicable diseases are declining, whilst chronic diseases such as cancers, cardiovascular diseases, diabetes, and become more increasingly prominent in the society. It means that we are epidemiological transition in this phase from which we are moving from one point to another. So this is change and transition. Then epidemics and other emergencies. Epidemics and other acute problems, for example, natural disasters, for example, the current situation in which we are dealing ourselves, the COVID situation, in which we deal with the emergencies and in which we try to mitigate the concerns of affectees, of the victims. So in this regard, we, the government, the people, and the care provider should have this point in its mind. At this regard, they should remember the problems that the natural disaster may arise. So, socio-economic variables are also very important in this regard, like what society is made up of and how society is turning with the passage of health sector, with the passage of development in the health sector. So health policies have had to be modified in the light of rapid development in some countries. The policies should change from one community to another community, but that change should be rapid. Because in recent decades, the national policies are increasingly favoring free market economy in place of welfare programs and central control. So for that, we need a better health services, and so socio-economic variables are playing its role in this regard. So primary healthcare function. It means that we should immunization, education on prevailing health condition, food supply and proper nutrition, safe water and basic sanitation, including family planning, treatment of common diseases and injuries, prevention and control of locally endemic diseases. We should take care, we should give some policies, the government should give a handout, a note, awareness campaign, a sort of workshop by which the awareness, by which the education, by which the issue can be addressed in front of society, that what type of problem they are facing, that what type of problem they are to uh, face, they are likely to face in near future, and how to control and how to prevent that issue, because prevention is much more cheaper than the cure itself. So if you prevent something, if you can prevent something from something very dangerous, or something very huge, with a very huge impact, so we should do this. We should the government should apply this. The government should, a country, a agency, or any health provider institute should give this opportunity to the people to prevent rather than to cure. Then the application of public health sciences and policy, that policies developed in response to immediate health problems, that we should uh, develop from existing knowledge. We should make our development from existing knowledge, and we should apply that knowledge to the specific diseases derived from national scientific research. We should apply that research as well. Then to achieve, what was the goal? The goal is to achieve the training for public health professionals, preferably in national schools of public health as well as abroad. So the conclusion is, not only but must policymakers be knowledge based, it must also be result oriented. Careful planning and skilled management can achieve good results. Policymakers must give high priority to strategies that will eliminate the major items of unfinished agendas that will plague many developing countries. So, this is it for today. But in the last, I want to remind you that in this session, we discussed health policy as a model. We discussed health policy to analyze, to know how to analyze different aspects of different policies, and we take health policy as a as an example. You can say that if we try to remember the steps we discussed, you if you will remember the steps we discussed in this session, it will be very easy for you to analyze, to decipher, to dissect any policy given to you.